to welcome Summer Hawkins to the seminar series. I met Summer back in 2009 when she joined the postdoc at Harvard Top Center under the Robert Johnson and Hawkins Scholars Program. And when she finished in 2011, she then shifted over to the School of Social Work at Boston College, where she's now appointed as an assistant professor. Her work broadly focuses on policies and mental health. And we'll see a good example of that today. A lot of the policy work focuses on public health policies, including tobacco policy. Summer, thanks for making it. You had 2 flights canceled yesterday. You probably woke up like 8 hours ago. And you're leaving in like half an hour. So we really appreciate it.
Thank you. And thank you, Harry, so much. It's really wonderful to be here. It's a pleasure to tell you about my work. And I was joking with Harry that I have 2 little kids who normally actually let me sleep past 4:30 in the morning. So you guys are really special. That early. So the work that I'm going to tell you about, so I'm a social epidemiologist by training. And so the work that I'm doing actually is in collaboration with Professor Ken Baum, who's an economist at Boston College. And so the reason for this title is because when we often do policy evaluation, we really, I think, look at a lot of the outcomes that we think we're going to see. Okay, we look at these anticipated outcomes. When we look at tobacco control now, it's really this umbrella term for all of these new and exciting products that are actually incredibly attractive to adolescents. And so if we don't look at these unintended consequences, I think we're really going to be missing something pretty big. First, I want to show you this. This was accompanied with a press release from the CDC. We're publishing the Youth Risk Behavior Survey data from 2013. And they were kind of shouting from the rooftops that current cigarette smoking is the lowest in 22 years among high school students. I mean, like, they were patting themselves on the back for doing this amazing job. And they really did a great job. I mean, this is pretty impressive. But I think we need to step back and say, is this reflective of all tobacco use? Or is this just a reflection of cigarette use? Because if it's not, then we're actually missing something. Because maybe adolescents are actually using something else, which is equally as dangerous. So why is adolescence a critical time for tobacco use? And I'm actually kind of using critical as like a critical period here in epidemiology. Because this is a time period when if people are adapting these maladaptive health behaviors, it's really setting them off on a different trajectory for the rest of their lives. So tobacco use increases dramatically across the teenage years. It doubles and triples between middle school and high school, and it actually doubles again from 9th through 12th grade. Okay, so it's enormous. I'm going to show you some data on that. And then also up to 90% of adult smokers start during adolescence, and it goes up to 99% by age 26. Okay, so if they don't start during these teenage years, they're likely to never start. So how do we get them to prevent beginning using tobacco? And then just the scope of this issue. So every day in the US, more than 3,800 youth smoke their first cigarette. I mean, that's just mind-boggling to think about the number of adolescents that we need to be addressing and touching in this area. So here are some data. These are actually from the National Youth Tobacco Survey from 2014. And I'm sorry the colors aren't as dramatic, but that was the first thing I wanted to point out actually was the colors. Because this is the difference between middle and high school tobacco use among these 2 different age groups. And regardless, I'm going to tell you about the bars, the labels at the bottom, regardless of the category, the difference is just 2 or 3-fold or 5-fold difference, okay, between use. Now we look here, we see any tobacco product use. I'm just going to focus on high school students because that's what the rest of my talk is on. Up to 25% of adolescents are using any tobacco product, okay? Up to 25%, which is huge. They're also using more than one product, which is also really interesting when you think about this time period. So they're kind of going across some different categories.
So is that ever use? Any use?
In the last 30 days.
Like once?
It could be once.
Okay, okay.
Yeah.
And sorry, I don't want to hijack the discussion.
Yeah.
If you just go back, I was just curious, one slide, so when that number, that 3,800, what's your sense of what fraction of those actually end up being regular smokers?
So that's a great question. I couldn't tell you the percentage, but
I don't have a percentage in my head, but I was just trying to think of.
So clearly there's this pyramid where a lot of them are experimenting all the time. The concern is not just this just one-off, and then they're doing it once a weekend, and then it becomes more frequent.
Right. I guess I'm just trying to think about sort of from the intervention side, right?
Yeah.
Is it really trying to like prevent ever touching it, ever experimenting, or is there some other window in there where people transition into like?
Right. So maybe it's those like trying to find which group is at highest risk, not the like just every users, but are the 5 a month or so. That's a great point. I'll have to think a little bit more about that. Sorry. Okay. So then they're experimenting a lot using these different products. And then we see here with cigarettes, this is a different survey. They have actually slightly lower estimates. But I also want us to focus here on cigars and smokeless tobacco. Okay, we often don't think of adolescents smoking cigars, and I'm going to tell you a little bit more about that in a minute, okay? But you can see that it's practically the same prevalence as cigarettes, and then smokeless tobacco is over 5% here. So I'm going to focus actually my talk on these last 3 products. So just to get us all on the same page what we're actually talking about here, and I don't need to really, I'm sure you're thinking, why am I telling you the definition of a cigarette? And it actually really matters because that's the fiscal policy. The tax scheme is actually dictated by the product and the definition of that product. So a cigarette is a roll of tobacco wrapped in paper, and it contains less than or equal to about a gram of tobacco each. As opposed to a cigar is actually a roll of tobacco wrapped in leaf tobacco or a substance, okay? So the industry has absolutely exploited the second definition in order to be able to make it more like cigarettes. So I'm going to show you these pictures and explain these definitions. So a little cigar now is this one, which looks exactly almost the same as a cigarette. So it's the same size and shape, contains 1 gram of tobacco, and usually contains a filter. Now a cigarillo here looks very similar, short and narrow, contains 3 grams of tobacco, and usually does not include a filter. Okay, so these are 2 examples here, tip 1 and 9. And this is when we think of cigars. This is like your grandfather's cigar that you think of, okay? They contain 5 to 20 grams of age-fermented tobacco. The biggest ones contain as much as a whole pack of cigarettes, okay? So this is not what adolescents are walking around smoking, okay? They're actually using these other products, and that's what the industry wants them to do. So when you look at market share, this is adults and adolescents, like everyone together, most of them are smoking the cigarillos and then the little cigars. So smokeless tobacco, the big category of it actually is tobacco that can be sucked or chewed and not burned. But again, within that, the industry has created this whole range of products that are very enticing, okay? So chewing tobacco is in the form of this loose plug, leaf plug, twist roll, okay, placed between the cheek and gums. And then snuff is finely ground tobacco that is dry, moist, or packaged in pouches or packets, sniffed or inhaled or placed in the mouth. Okay, and we typically think of these ones here, this can of Skoal, maybe a baseball player, or the pouches that they're using and they're putting it in their lip. Okay, and you can see here by the market share, most of the products are right here. But there's these products. There's also snus, which is a new product. Okay, so the industry is really trying to go really far with these different areas. Because again, it's dictated, the fiscal policy is what they're going for here. They're not taxed as much as cigarettes. So the health consequences, I'd be failing you if I didn't tell you why this is also bad for you. The U.S. Surgeon General has created a series of reports about why we should not be smoking or using tobacco products in general, causally linked to smoking, okay? The whole range of cancers here, and then every chronic disease. The red color just means that the most recent report actually said this is a new link, okay? So more and more evidence is coming out that it affects every single organ system of your body. When you look at the other 2 products, okay, cigars, smokers actually have lower rates of cancers and related diseases, because in general they don't inhale, but they still have direct exposure to your lips, mouth, tongue, and throat. And what I think is interesting is most of these studies have been done on the big cigars. So I think now that we're using all these different smaller products, I'm curious to see whether the literature is actually going to show more of these consequences, much more like cigarette use. Smokeless tobaccos linked with mouth, tongue, cheek, and gum cancer, cancer in the esophagus, and pancreatic cancer. And again, I'm sure we can all imagine that PSA we've seen somewhere where somebody's jaw has been removed because of cancer from chewing tobacco. Okay. So again, these 2 products are still very detrimental to our health. So we think then, okay, what's hard with adolescents is they aren't thinking about the consequences, okay? They're young, it's not affecting them. These symptoms aren't going to be happening for 20, 30 years. So how can we, though, start curbing this behavior? And one area really is tobacco control policies. So the U.S. has experienced this rapid expansion of policies, particularly over the past decade. Okay, there's been increases in taxes, and we've had the enactment of smoke-free legislation. But the aims of these policies are actually very different. So taxes, regardless of whether it's cigarettes, cigars, smokeless tobacco, they are targeting the user of the product, okay? The actual person using the tobacco product. Smoke-free legislation has come about to protect non-smokers from secondhand smoke exposure, okay? And it's been very effective from studies from all over the world. When we think about these policies for adolescents, they have a very specific purpose, okay? Of course, they're affecting adults as well. When we think about with adolescents, we hope to reduce the initiation of smoking, reduce tobacco use in general, reduce the frequency, and encourage the quitting. We feel that if we can target this group now, we're then again going to set them off on this different trajectory and maybe never start using tobacco. Okay, so how can we really look at this in the teenage years? So then you have to say, okay, so what actually has been done? Okay, we all want to know that before we actually embark on a study. So most of the research has looked at cigarette use in adolescents and the impact of policies. There's some study, only a few studies though, have actually looked at the price or tax structure of cigarettes associated with reductions in intensity of smoking. So there's some evidence out there. And there's less on smoke-free policies. Most of it because the studies that have been done were done in the early 2000s when there weren't as many smoke-free policies around. But when you look at these two other areas, okay, this is what you get excited about as a researcher. Like 3 studies, I only found 3 studies out there that have looked at these products in adolescents. So smokeless tobacco, there's only 2 econometric studies that found that higher smokeless tobacco taxes were associated with lower frequency of smokeless tobacco use. Okay? Cigar use, only 1 cross-sectional study. Higher cigar taxes associated with lower cigar use. We know cross-sectional study is not the best method for policy evaluation because we can't rule out reverse causation here. But both of these studies, to note, were done with data prior to 2001. Okay, about 15 years old. So much has changed with these products, so much has changed about the socio-demographic characteristics of the adolescents using these products, that we felt that this was a really important piece to look at.
To what extent is tobacco a substitute for cannabis or marijuana?
Oh, for those products? I think there's very different populations. I think there are probably some overlap. But in general, there's a much higher proportion of adolescents are using tobacco products than are using pot or marijuana. Okay, so then I want to just explain how we kind of came about to our study. So this is the price of cigarettes in Massachusetts about last year. And I was just at a convenience store on the weekend at a gas station, and it was like over $10 a pack, and it says plus tax. So think about how much 1 pack of cigarette costs for an adolescent. So we thought, yes, you can do the classic study looking at the impact of tobacco control policies on cigarette use, among adolescents. But what happens when you see this? When you're in a state that really jacks up their cigarette tax, and then you see here, I'm sorry the prices aren't as clear, but for one of these round, tins of Skoal, it's about less than $3, $1.49. If you buy 5 cans, it's only $13. When you look at now the new cigars and cigarillos, they're less than $1 a piece. You can find some 2 for 99 cents. We know adolescents are incredibly price sensitive. So we hypothesized, what could be happening in those states that are increasing their cigarette taxes? Could we actually find a substitution effect with some of these other cheaper products? Okay, so that's what we decided to explore, these 2 different areas, which is I'm going to tell you about. So the 2 research aims, one is to examine the impact of cigarette taxes and smoke-free legislation on current adolescent smoking and then smoking frequency overall. The second is then to evaluate the impact of chewing tobacco or cigar taxes, cigarette taxes, and smoke-free legislation on adolescent use and frequency of each of these products, smokeless tobacco and cigars. And then for me, the really interesting piece is this idea of initiation by age. Okay, so do we actually find that policies are affecting adolescents differently depending on how old they are? And could we potentially see that as pushing up the age of initiation? So we want to run some interactions by age. So the data that we're using, the Youth Risk Behavior Survey data, I'm going to tell you a little bit about it. So it's a self-reported survey of health risk behaviors of 9th through 12th graders attending public and private schools. It's been conducted by the CDC biannually since '91, so it's conducted every odd year. States must obtain a minimum response rate of 60% to be included. So they won't release the data until it reaches that rate. So we had 8 sweeps of data from '99 to 2013. So our first aim, we have 717,000 adolescents from 43 states. And just to let you know, for those people that are interested in kind of getting data and kind of asking for it, the CDC only releases 32 states. Okay, and they say if you want to contact these other states, they might give you more data. And, not that I don't have enough to do with my time, but I thought, why not? Okay, it's only an email. And I was lucky enough to get data from another 11 states. Okay, so it's really these are the sort of things that you should try to do, because I haven't seen a study of the YRBS with this sample size. So for aim 2, we had a little under 600,000, and from 41 states, and that's because the questions on smokeless tobacco and cigar use are not core questions. So 2 states didn't ask them at all over the time period. And then other states decided, who knows, maybe due to budget cuts, not to do that year-state combination, okay? So it's not that we have sampling bias, it's that we just have some states that didn't even, enter into that state-year combination. We do, though, have very limited sociodemographic information. This is a limitation of the YRBS. They only ask information on age, gender, and race ethnicity. I think we need to kind of question why they're not asking adolescents, what say, year of education did your parents complete? It seems shocking that that's all we have on these students. It's also really hard to reviewers when they say, why didn't you adjust for income? And you're like, because they have nothing. Like, there's nothing else besides age, gender, and race ethnicity. So that's a limitation I'm going to throw out there. So we have 3 tobacco questions that they ask in the survey, hopefully all in the same way. So during the past 30 days, on how many days did you smoke cigarettes? How many days did you use chewing tobacco, snuff, or dip? How many days did you smoke cigars, cigarillos, or middle cigars? Okay. So from there, we conducted 2 outcome measures. We have a dichotomous outcome measure of current use, so 0 versus yes, of 1 to 30 or 30 plus days, and then a categorical variable indicating frequency. So they asked 7 categories. We kind of collapsed them down a little bit: 0, 1 to 5, 6 to 29, and 30 plus. So those are our 2 outcome measures.
Why you collapsed it?
Why? So it actually originally came in 7 categories, but we just collapsed it because some of them had very small sample size, small sizes. So we made it more manageable here. It wasn't continuous. It wasn't asked how many days. So now that we know the state that the adolescents lived in, we know the year of the survey, we then wanted to link that with information of the state where they lived in. So we have a series of state-level policies. The first is cigarette taxes. So we take that from the tax burden on tobacco. It's a monthly tax in cents, so it's been translated into real dollars using the National Consumer Price Index. The survey is conducted in the spring of every cycle year. We don't know the exact month. And so we average the tax in the spring from January to March. So next, once I started looking at the taxes on chewing tobacco and cigars, I realized why people have never actually published in this area, and it's because it's incredibly hard to collate this information. So the CDC luckily now has a database where they give you the tax per year, once a year, through the state tobacco activities tracking and evaluation system, but it's based on a percentage of the retail sales price, manufacturer's price of sales, or wholesale price of sales. And you might think, these are all three different measures. When you kind of look at them, luckily they don't change over time. States aren't actually flip-flopping between how the tax is measured. And they were pretty consistent. So we just went with it. We've noted who does what, but this is as best as we found we could do. The problem is 8 states had taxes based on the price per ounce of chewing tobacco or price per cigar. Okay, so they decided we're going to just say it's 2 cents for this versus a percentage. So we actually looked up how much it costs in that state, calculated what it would be for that year, and then created a percentage. Okay, and so what we did do in the end was run sensitivity analyses excluding these 8 states, and we found no differences. Okay, so I'm just going to show you the results of everybody. But to say it's not easy, okay, these things don't make it easy when we're trying to run look at these types of questions. So just to give you kind of a map of, first of all, the states that are included in the data set. So those that are kind of more in white or gray are those excluded. Okay, data just weren't available. And then you can see the cigarette tax by color. So less than $1, $1 to $2, $2 to $3, and $3+. And as you can imagine, the taxes are much lower in the tobacco growing states here than in other parts of the country like New England. Okay? But even within those states and time, okay, so within states and over time, they change dramatically. Okay? So we have a lot of change going on, which creates this really nice natural experiment across the US. So just to give you some numbers, in 2013, the mean cigarette tax was $1.44. It ranged, though, from 17 cents in Missouri, which, let me tell you, has not changed since 1999, okay, and $4.35 in New York. Mean chewing tobacco tax was 39% of the price, ranging from 0.41 in Alabama to 210% in Massachusetts. And if I showed you a map of chewing tobacco tax, you would see a very similar pattern. But what's interesting from a fiscal... For the chewing tobacco? This is per pack of cigarettes, yeah. And what's interesting is actually 29 of the 41 states had the same percentage tax for cigars and chewing tobacco. So from a fiscal policy perspective, regardless of the prevalence in that stage or anything, they actually have the same percentage, okay? So they actually, most states are not actually choosing one or the other. They're doing both exactly the same.
What explains the variability in these states?
I'm sorry?
What does explain the variability? So this is a natural stream.
What explains the variability in the tax across states? A big piece of it is because here is where tobacco is grown. We have massive tobacco, like lobbying industries. The tobacco lobbying industry that is not allowing, that's blocking legislation. We pay our congressmen, our politicians to not support increases in legislation. The other issue is that in states where they smoke less, it's really easy to pass these laws. So they do.
Go back to your means again. What's the average cost of a pack of cigarettes? Because I'm just trying to figure out what percentage that means cigarette tax is.
Yeah, so I have some information on the inflation rate at the end. So here it costs $12 to $14.
But that's including tax.
Including tax. So a pack of cigarettes is the state tax, the federal tax, and then any markup from the actual establishment that does it.
The packet you showed us was basically $10 plus tax. So what's the average pre-tax price?
It really reflects these. So it's very cheap to buy the pack here. It's much cheaper. Okay, so the federal tax is the same everywhere. But if you buy here, I actually don't know off the top of my head, but I've seen figures, $4 or $5 a pack. And here it's because we have another $4 in tax added on.
I guess what I'm trying to just calculate that is just what has a higher percentage tax? Is it chewing tobacco
here.
or is it
I'll say it again.
It's cigarettes. Because the average cost is $10, and then in fact it doesn't. Then in fact, if the mean cigarette tax is $1.40, and the average pre-tax is 10, then that looks to me like it's less. Right?
Yeah, but it's not. Let me tell you, it varies.
Yeah, I'm having a hard time seeing the average cost then of a cigarette pack for it to be 40%.
Well, think about it. If the tax here is at 17 cents and it costs $5 for a pack of cigarettes, that's really small. It's a really small percentage. $4. versus like a $14, even if it's a $12 pack, we're looking at 30 or 40%. Are you saying compared to the chewing tobacco?
Yeah, it looks to me like it's less. That's what I'm saying. Because it looks to me like the percentage tax on cigarettes is potentially less than the percentage tax on chewing tobacco.
I'd have to come back to you. I don't know the numbers off the top of my head, but
yeah, I just
to
me.
Yeah. Yep, I can look into that. Okay. So the other policy that we want to look at is smoke-free legislation. So of those 24 states, 24 of the states had the same enactment of legislation in workplaces and restaurants. And so we use restaurant legislation as a proxy for the smoke-free policies in that state. And then adolescents were identified as living in a state with smoke-free legislation was implemented by March of the cycle year. And then finally, we know that the funding of tobacco control programs and activities, it varies widely across states. Okay? Although, interestingly, all the studies that have used this measure have found that it has no indication at all for no association with actually the cigarette use, but we felt it was important to include it in our models. So we included an annual per capita amount of kind of appropriations or grants received for tobacco control efforts from state and federal sources, the Robert Wood Johnson Foundation, and the American Legacy Foundation. So this, again, is just to illustrate the smoke-free legislation across the U.S. So we have, this is the no colors in the light. The darkest colors are yes. And so again, most of the more tobacco-growing southern states are less likely to have smoke-free legislation. This is at the state level, though, so remember, there might be some local towns or cities that actually have smoke-free policies in place. So 29 of our 43 states had smoke-free restaurant legislation. So our methods of running difference in differences models, so we're able to compare those states with policy changes to those that don't, but both of these sets of states are experiencing the same time trends. We're able to cancel that out and look at any changes associated with the policy. So we're running a probit model for current use. It's a dichotomous outcome here. So for those of you that like equations, we're looking at the probability of smoking. We have our tax, restaurant ban, funding, or tobacco. And then we're adjusting for covariates, okay, age, sex, race, ethnicity. I'm going to show you outputs of average marginal effects, which is the change in probability of tobacco use associated with the change in smoke-free legislation or the change in tax policy. And then for aim 2, we're going to run ordered probit models, okay, for the frequency. And this is interpreted a little differently. You have each of the predictor variables across the different outcome categories have to summarize to 0. So I'll explain that when I get to the results, give you examples. And then all the models have state and year fixed effects in them. We're running using the YRPS sample weights as well. And to really get at this differential policy effect, we're going to run interactions with age, okay, to see whether it impacts adolescents differently depending on their age. So just one more map is really just to show you the mean cigarette use across the U.S. Again, variable depending on where you live. The lowest, less than 14%, and then in 5 bands up to 25%. You do see much higher rates here. Kentucky, West Virginia, the Dakotas, for example, where again you see much higher rates in adults. You see higher tobacco grown in general. And to just give you some numbers, 19% of adolescents use cigarettes. This is over the entire study period. It ranged from 7.5% in Utah to 28% in South Dakota. So for the percentage for cigars and smokeless tobacco, almost 13% of adolescents use cigars, 4.5% in Utah to 15% in Montana and New Mexico, and then 7% of adolescents use smokeless tobacco. Okay, so again, ranging from Utah to South Dakota and Wyoming. Okay, so a lot of overlap with these products, but it's not a perfect match. Okay, each of these states has very different demographics about who's using these products. So now to show you some demographics, and I appreciate the numbers are small. I'm really just looking at the patterns.
Just on the design side of what you're doing.
Yeah.
So you're looking at these differences across the tax legislation in what year?
All years. So we're looking at changes within states and across
So
states
you have to
over
normalize
time.
the period from which you're looking before and after, so that you can do the difference. Is that what you're doing?
So every adolescent is marked with what the tax was in that state in the spring of that year. So we're comparing those adolescents within a state that have changed their tax over time, okay, so South Dakota that maybe increased over time, compared to states that have also changed but to different amounts, and those states that haven't. Okay.
And is the idea that it should be a contemporaneous effect?
So like an instantaneous.
Yeah, I mean, is that a basic assumption for these?
Yeah. That's
Okay.
what we did with this one. Thinking that if the price is increased by $1 today, on average, this is
Then tomorrow, students will...
exactly, because it's within the last 30 days is when it is. It's very different than the other work I do when women are pregnant for 9 months. You have to think of what actually is the
Right.
time period.
Yeah.
So that's what we did for this. So it's not as precise.
I'm slightly that the idea is granted the state level driven likelihood of moving the tax in the let's call it pre-tax period.
Yeah.
It's endogenous to the outcome we're looking at. So to a certain extent, you will have to control for the differential trends that proceed on that one. To those seem to be, the states don't do this at random. You said that actually this election is based on the outcome. So it's a little bit of a tricky issue.
But even in some tobacco growing states, we have tax changes. So we don't only have those changes in the states with very, low smoking levels. We have changes on most of the states. Missouri is the only state that didn't actually change its tax at all.
The magnitude of the change may well be explained by the outcome. That's the issue. So if you have low taxes in the states in which people don't smoke a lot, and this is totally driven by your outcomes. So you're actually using the outcomes as the instruments, which is a little tricky. I mean, if you could control for the trends that we see to that happening, then it would be okay. We got that other issue, but I think that
Okay. Conscious of our time. I haven't got to the good stuff yet. Okay. So the demographics, just to point out some overall trends, that's all I want to explain here, is we look at cigarette use, smokeless tobacco, and cigar use. Okay. The age, you can see it goes from, for example, cigarette use from 11% to 27% in 18-year-olds, increases across all three. Race ethnicity is interesting in that we have whites that are the higher prevalence group in cigarette and smokeless tobacco. For cigars, blacks and Hispanics are more likely to use cigars than whites. And we have sex differences, so males are always more likely to use the tobacco products. And this is really to show you that these are adolescents using lots of different products, okay? So if you're using cigarettes, you're an odds ratio of 4 of using smokeless tobacco, an odds ratio of 14 to using cigars. So you can imagine this, maybe they're actually using these products at different times, okay? But they're very comfortable, it seems like, switching back and forth. And also, if you use current smokeless tobacco or cigars, again, you're more likely to use the other type of product. So just to get into the results, so we're first looking at the impact of cigarette taxes, smoke-free legislation on current adolescent smoking and smoking frequency, and then this interaction by age. So just to orient you first of what the tables that I'm going to show you are going to look like. This has the cigarette tax, smoke-free restaurant legislation. All the models are adjusted for the tobacco control expenditure, age, race, sex, state, and year in here. And so you can see here overall, okay, there was no effect of cigarette taxes on adolescent smoking, but we found a nice effect with smoke-free restaurant legislation. For those states that enacted smoke-free restaurant legislation, adolescent cigarette use decreased by 1.1 percentage points.
I'm sorry, a quick question. So, I mean, I know it won't really change sort of your p-value necessarily, but so you're estimating that contrast has a $1 increase in cigarette taxes. What was the average increase in tax? Do you have a sense of like when states decided to do that? So well over $1? Was it less than $1?
Well, we did $1 just for round
No, that totally makes sense, but is this...
It was on, I mean, they're actually increasing it over this entire time period. Most states had multiple time points of increase. I would say over the time period, it was at least $1. So New York.
For any given, I know over the whole time period, but like in May of 2012.
I would say most states it was like around 50 cents at a go because the legislation comes in. They're not doing like 5 cents. They're actually doing something big enough that's shown in effect.
Yeah, I think it's a relevant. I don't know the idea of about how much of a change in the price that if you're assuming it's a contemporaneous effect, like what would it take to shift behavior at that time, or is it more of a cumulative effect that you might not be able to pick up that way? Anyway.
But adolescents are very price sensitive is the other piece, is that they actually are responding to something.
Are they?
Yeah. The young ones are. So then we run an interaction with age. We find a significant interaction. It's actually those that are the youngest adolescents that are impacted. So we see that the 14-year-olds, every dollar increase in taxes decreased smoking by 2.2 percentage points, and 15-year-olds 1.6. I think what's nice about this, you can potentially see a gradient here. Obviously not significant, but kind of going down in effect. Now when we look at frequency, we see it's still the same pattern. I had to kind of condense everything just for space. So what you do, we can see here no overall effect with cigarette taxes. We're looking at our frequency as in these bins, these different categories. And so when you run these models, these ordered probits, you see that it increases the likelihood of smoking 0 days, and it decreases the likelihood of smoking 1 to 5, 6 to 29, or 30 plus days. Okay, so again, showing a significant interaction with age, and again, we saw the very similar coefficients to what we saw before. So the 14 to 15-year-olds, in summary, were responsive to taxes, and all adolescents were less likely to smoke with the enactment of smoke-free legislation. Okay, so now getting into the second one. So here we really want to look at multiple taxes at the same time. So here we're looking at chewing tobacco or cigar taxes, cigarette taxes, and smoke-free legislation on adolescent use and frequency of these products. So just to orient you, here again, all of the covariates are the same. But we are adjusting for cigarette use, we're adjusting for the other type of tobacco use, so if it's smokeless tobacco, adjusting for cigar use. And because chewing tobacco tax and cigar tax was practically identical in 29 of the states, we're only including one tax in the model. So here we're going to see tobacco tax, which here is the chewing tobacco. We found no effect of chewing tobacco tax on chewing tobacco use. Okay, no effect. What we found was that every dollar increase in cigarette taxes increased smokeless tobacco use by 1 percentage point. We also found the enactment of smoke-free legislation increased smokeless tobacco use by 0.7 percentage points. Now remember, the smoke-free legislation, it only covers combustible tobacco products. So you could be in a restaurant and still use chewing tobacco, and that's completely fine with the law. So now when we look at cigars, very similar pattern. No effect of cigar tax on cigar use. We found even a stronger effect with cigarette taxes, and you can really think again about this interchange potential of these products. So every dollar increase in cigarette tax, increasing cigar use by 3.1 percentage points. And we actually saw a similar effect with the cigarette use, where a decrease in cigarette use in response to the enactment of smoke-free legislation. There also was no interaction with age, so we found this was a similar effect across all ages. So very similar outputs when you look at frequency. Okay, so we found no effect on frequency of the chewing tobacco tax. We found an increase, a decrease in the likelihood of being 0 days, but an increase in the likelihood of using chewing tobacco on more days per month. And again, a similar effect with smoke-free legislation that we saw before. And the same pattern here with cigar taxes. So no effect of cigar tax on the frequency. And then we saw a much larger, so it seems that the cigarette tax is increasing the likelihood of using cigars 1 to 5 days, much more than these other categories. Okay. So again, this is showing evidence of a substitution effect of where you see those states that are increasing their cigarette taxes, students or adolescents are more likely to use these other tobacco products. So just some strengths and limitations. Okay, the YRBS is representative at the state level. We had 600 to 700,000 adolescents in our data set, and again, this is a very active time of policy change, okay, when this is all happening. Clearly we have limitations. Okay, students self-report, okay, potential reporting bias. We had smoke-free legislation measured at the state level again. Maybe students are exposed to more local policies. But this is the big one, okay, that's a real challenge, is that we don't actually have information in the YRBS on e-cigarettes for hookah use, okay? These two questions, which would be fantastic to look at, aren't actually even asked until the 2015 survey, okay? So they're really missing something by not looking at it yet. So this is the other part of the graph I didn't show you, figure I didn't show you at the beginning, okay, is that this is what we're seeing now, okay? E-cigarette use is surpassing cigarette use, cigar use, smokeless tobacco use in adolescents as well as, okay? So this is what I think is we need to be really thinking about, not just our policies turning students to these other products, what about these even more unregulated products that are cheaper, that are more exciting for adolescents, okay? And I think that's where we need to be kind of moving this area forward. The other piece that is so critical when you think of policies and adolescents is actually flavored tobacco. So this was a huge policy that came into place, legislation, the Family Smoking Prevention and Tobacco Control Act, which required smokeless tobacco product warning labels. It banned flavored cigarettes except menthol, and it bans packages of fewer than 20 cigarettes, which is why you can't go to a store and buy a single cigarette at a time. But there are massive loopholes in this, okay? So the industry said, fine, we won't flavor our cigarettes. We're going to flavor our cigars and our smokeless tobacco. And that's fine with our policy. We also can sell individual or small units of very cheap cigars, and that's fine too. Okay? The problem is that the most recent data show that among those adolescents that are using tobacco, 70% are using flavored products. And why wouldn't they? It tastes way better, okay, than regular smokeless tobacco or cigars. And just to show you what I mean by this, so you can get smokeless tobacco in any flavor you want. Fruit punch, tropical blends, strawberry, grape. Okay, it all sounds amazing. It also is really cheap. Okay, 2 for 99 cents, 3 for 99 cents. Okay, and this is what we're seeing at convenience stores. Okay, and it's called Swisher Sweets. Like, it doesn't even sound, it sounds like those candy cigarettes that they used to give out at Halloween. I don't think we do that anymore. But that's what we're seeing now. Okay, the industry is really saying, fine, you've made this legislation, we're now going to work around it. Okay. So just to give you some summary, and then I'm all done. We can talk for a few minutes. So first, from a policy perspective, we found that 39 states increased their cigarette tax over this time period of our states in the study, but 16 states either decreased or maintained their taxes on chewing tobacco or cigars. So in real terms, this translates to a 190% average increase in cigarette taxes compared to an 83% increase in chewing tobacco and a 53% increase in cigar taxes. That's in those states that actually did increase their taxes. And so what our findings show is that the youngest adolescents, again, are the most responsive to cigarette tax increases, which we believe suggests either a decrease or delay in the uptake of smoking, okay? Then we found that when adolescents are faced with high cigarette taxes, they're likely switching to cheaper alternative tobacco products, such as smokeless tobacco and cigars. And then smoke-free legislation reduces overall adolescent cigarette and cigar use, but it actually may increase smokeless tobacco use. So just my last slide, I just wanted to talk about a few policy implications. I think when we think of adolescent tobacco use, we really need comprehensive tobacco control policies that are inclusive of all tobacco products. The problem is we always just talk about cigarette taxes. That seems to be the only thing that's in the conversation. Why aren't these other products in there, and why aren't they being taxed at similar rates to discourage substitution? I think we should enact smoke-free legislation. There's just huge, more and more we need to push for it because there's just benefits across the board for smokers or tobacco users and non-tobacco users. And then I thought I would throw something in controversial just to make sure everyone's paying attention. To say that we want to encourage smoke-free legislation. Maybe it should ban all tobacco products. Okay, maybe if we go to a restaurant, we shouldn't even allow people to use smokeless tobacco. Okay, maybe we should just make sure it's a blanket policy and not just those that are combustible. Because now states are having to go back and change their smoke-free policy to include e-cigarettes. Okay, every state has to go back and change their policy because it wasn't included. Okay, it's too narrow of a definition. we really want to close the loopholes of the Family Smoking Prevention and Tobacco Control Act, particularly for those with flavored tobacco products. And then my last little thing that I always talk about as somebody who listens is that we really need these dynamic national surveys. Okay, why the YRBS is only capturing these new products now, and the National Youth Tobacco Survey has done it for 3 years, is just crazy. We could have thrown in one question, and I appreciate this, how expensive it is, but it's just these things, we need to capture these emerging areas. We're really doing a disservice for surveillance and public health. And then the other flip side is very few of the data sets we would love to use for these sort of evaluations are only conducted at the national level. So the National Youth Tobacco Survey, the one I showed you before, you can't get the data lower than the national level. They don't release it. So we have this really hard balance when we're conducting these policy evaluations of trying to get what we want, and then there's others that have it what we want, but they don't have it low enough in the low enough level. Okay, so I feel like we've got to be working in this area too about how do we kind of maybe upwardly manage these people making these decisions. And then lastly, I want to thank my faculty member, colleague, Kit. I also had the pleasure of working with an undergrad on this project. It was actually really eye-opening to see research through her eyes, because she couldn't understand why it took us 9 months to get a data set pulled together and linked, and then it took us 2 months to do the analysis. So it was really kind of fun to see that. Every week she was like, we're still making this one variable? What is going on? So it's very slow. So we have funding through BC, as well as I have a K award, and then I want to thank the CDC and the states for their data. Thank you.
So I think we've got 10 minutes for some questions. Get up and
Please. Okay, so I have a question from the perspective of someone, when I was a teenager, I was enticed by the flavored cigarillos.
Yeah.
I had no idea they had tobacco, they tasted good. I didn't know anything else other than that, but I was obviously way too young to buy them. When I was around people who could afford to buy them for me, they would. Now, is there any data, is there any questions on the proximity to the closest store, and I don't know if that would make a difference. Just for me, for myself, I only experimented when someone else could buy it for me, but I never kept up with it.
So they don't ask proximity to a store. The YRBS does ask, where did you get your tobacco products? And about 20% of students say they actually purchased it from a convenience store. And then a bunch of others, most of them actually are saying they're getting it from somebody older. But I still think it's interesting that almost 1 in 5 are still able to buy it, even though it's actually illegal.
Well, I find in my personal case, the convenience store closest to our school, he sold anything to children. Because he's like, well, you're going to get it somehow, so I might as well make money off it. So.
There you go.
maybe following up on Sam's point about the amount of the increase, I wonder if you can look at whether there's some nonlinear effects. So the kind of dollar increase doesn't matter if the tax is $1. That's
like a threshold, you mean like a threshold effect,
yeah.
Maybe to see it has to be over X amount.
Yeah, I'm curious whether it's not really linear.
To see how price sensitive, if it only increases by a quarter, does that change their behavior?
Yeah, and also
is that what you're
depending on the
saying?
base rate, I guess, the base tax rate.
Yeah, we definitely could do that. The other thing, just as we've talked about, using quasi-experimental methods that I haven't ever done before is regression discontinuity analysis, thinking that 18-year-olds are legal to buy this product in some states, most states, but the 17-year-olds and under aren't, and then we see, even though we can see an effect, is there something going on at age?
But very fuzzy.
It is very fuzzy. It's
Discontinuity, yeah.
And
Also consistent with this story.
Yeah, exactly.
Yeah. And the other real challenge is because all these surveys, they stop at 18 or they start at 18, you don't get this nice, we want to get to kids 20, we have a nice thing before that, but I'm trying to just think, because I've never done it before, I'd like to try that method.
So if you go to the WHO's tobacco control website, all they really talk about are taxes. Now, this is one of a handful of recent papers I've seen that find really no effect of cigarette taxes on use. What's your sense of
Use among who, though?
Well, so on average, let's say amongst the youth population, it's true you didn't.
Okay.
Yeah. So on average, it looked like there was no effect. I mean,
Right, yeah.
So, what's happening? Are taxes not effective anymore? Or should we? I don't know. What? I mean, because if you look at all the econ lit, all the,
Yeah.
I mean, WHO is just like hammering people about the need to raise taxes, especially
that was
in
the
poor
most
countries.
recent report. Right, exactly.
I don't know.
Right,
So
so
what's
I
your
mean-
sense of why there's less impact?
Yeah, so right, initially all the research, I mean, like you think about 15, 20 years ago, it was huge effects.
Yeah.
And I think part of it is over time, we're seeing very big changes in who's actually using these products, the socio-demographic characteristics. I think that, I think we're actually getting to the point where we're kind of getting this small group of smokers, and then how do we actually get them? I don't think it's going to be jacking up taxes even more. Because other work that I'm trying to do now, looking at using another data set is actually to see what people then are not going to be used. Like I'm concerned that people are then going to say like, I'm not going to feed my children because I need my, or I'm not going to heat my house. So I actually think we need to look to something else. I think we've reached a piece. But I think with the other products, we are not doing enough. And my concern with that sort of the message of WHO is unless we say we want it to be across products, we're going to get this substitution. I mean, e-cigarettes, there are no taxes, right on the internet. So that's a huge issue.
Do you have any data on drugs other than nicotine? Because it seems to be one unintended consequence would be to push you into other tobacco products, another would be to push them into other right? And so cigarettes are really expensive now. Let's find out probably it's illegal, but we know there's a place, right? Or pot,
marijuana or something.
Yeah.
Yeah, we could definitely,
We could
these
check
data
that.
actually have pretty good questions on alcohol use and marijuana use.
Yeah.
So so you think that similar hypothesis that in those states that are really increasing that, adolescents that aren't going to be using these
Yeah, and I'm thinking, especially since you find such low rates, for example, for black kids, right?
Yeah.
So,
Right.
like, they're price sensitive there,
Right.
and then into alternatives that are eventually cheaper.
Yeah, that's a great idea. We could definitely use the YRBS data for that, which is nice.
I think that in the lines of what she was saying about the distance from the school to the groceries, if you have two otherwise observational equivalent kids live in this place and go to school in this place, the one who is more likely to be smoking tobacco is perhaps the one who has in the surroundings of either the school or the home somewhere they can buy it. So, and because the kids are not the ones who select where they go to school, at least not in high school, but at least in elementary school, or where they live. That might work very well as students or something. So information. Now the question is what data will support.
I was just going to say, give an idea.
Well, in fact, New York State has school data that has both things, information and the Chicago Public Schools will eventually, and the Florida State Department of Education. I don't know the extent to which they assess risk of behaviors like smoking tobacco and the like, but you might try to use administrative data instead of survey data.
Well, for example, New York City does their own, YRBS. You can always petition. Sometimes if you go to the local health department, well, New York is huge, but they actually sometimes release the school name. You could maybe do some sort of thing like that. That's a great idea. I love this layering, or how can we link it? It can be really hard to